Good afternoon, ladies and gentlemen. Thank you so much for joining us on today's edition of the program, Your Health, and on Equinoxe Radio Multimedia. For presentation, I am Immaculate Fogwe. For centuries, leprosy has been considered as a highly contagious and dangerous disease that struck especially those who were considered unlucky and cursed. In fact, biblical leprosy is only referred to as a skin condition, but also the state of ritual impurity and punishment for sins. Even today, the term leper is widely used to mean an outcast that is really offensive to the hundreds of thousands of people who are affected by the disease. On today's edition of the program, we plan to demystify everything concerning this particular disease, leprosy. And today I'll be having my co-host, AC Lucy, on the program. Good day to you, Lucy.
Good day, Immaculate Fogwe. Good day, ladies and gentlemen, Equinoxe Radio viewers, and of course, listeners.
And my guest for the day is no other person than Dr. Ahmed For. He is a public health consultant. It is nice having you on the program today.
Thank you very much. It's nice being with you people this afternoon.
As I earlier said, today we are planning to demystify everything that concerns leprosy. So, doctor, can you please tell us what exactly is leprosy?
Okay, leprosy, the word may sound new to some people and old to some ears. Is an infectious disease caused by a bacteria known as Mycobacterium leprae, and it is also classified as one of the neglected tropical infections, most commonly in sub-Saharan Africa and tropical environment. Another name for leprosy is also known as the Hansen disease, which many people may not know. This name is also known as the Hansen disease. So every year, a World Health Statistics shows that about 120 countries are affected with this disease, and about 200,000 new cases are reported yearly.
So what are some of the factors that can make one prone to leprosy infection?
Most people who are prone to leprosy are people living either in a tropical or subtropical environment where the climatic conditions are conducive for the bacteria to grow, and also people who have lived closely with those infected for quite a long time.
And doctor, we are talking about some parts, like there are some parts are being affected by this leprosy infection. What are the parts that can affect or can be affected?
Most leprosy attack mostly parts like the nerves, the extremity of the nerves, the skin. We have the nasal passages. We have the respiratory tract. We have also the fingers, the toe. The skin are one of the most highest part affected by leprosy.
And we are talking about the symptoms. How can I identify a leprosy patient?
Leprosy, first of the signs and symptoms, we have skin lesions, common, where we have a reddish skin. In some cases, we have the skin are reddish. We have muscle weakness. We also have numbness in the hands, the legs, and the feet. We also have what we call an increase or decreased sensation in temperature. Means people who have leprosy, they may not be able to identify what is hot or cool because the skin tissues have been damaged. Then we have lightening of the skin tone. Those who are also affected by leprosy, you may see their skin lighten more than before. And then also we have in most cases where the toe and the nails or the fingers are all destroyed by the bacteria.
Now, there are four major types of leprosy. Which among these types is severe?
We have the four types. We just go straight to. We have the tuberculosis Hansen disease or leprosy. We have the lepromatous, which is the most deadly of all forms because this particular species damages the tissue very rapidly in a very short time and causes more degradation of the body tissues. It's the most deadly and one of the most common.
And how does this leprosy spread, like from person to person?
Actually, we want to also enlighten the public that leprosy is not congenital. That means not genetically linked. That since parents had leprosy, children are bound to have leprosy. No. Leprosy is mostly spread, it's infectious, but it's mostly spread through contacts. So we have contact with the mucosal secretion, the mucus from the mouth or secretion from the body that may contain this bacteria may have transmit leprosy. We have people who are taking care of lepra. People who are suffering from leprosy for quite a long time. They get in contact with the body of these patients. They get in contact with the cloth and other articles of this patient. It is possible for them to get infected.
Are there any confirmed cases of leprosy in Cameroon?
Well, for the past years, we have not actually, right up to 2016, we have not actually had leprosy was almost extinct in Cameroon. It went to hiding. But since the beginning of the crisis that we have in some of the regions in Cameroon, there has been an outbreak of leprosy. We know leprosy is classified an epidemic. It's studied under epidemiology. It's an epidemic disease. It comes once in a while and disappears. Since the Northwest and the Southwest crisis and the crisis in the far north, there have been an outbreak of leprosy. Like recently, it has been reported about 300 cases are being handled in Cameroon presently. And then about 70 cases in Nguti and Miami. These areas, they have discovered some cases, and the far north, and equally in Fumban, where we have also, they have discovered traces of this leprosy. This report is given by our #1 permanent secretary of the National Commission for the Control of Leprosy, Dr. Taba Enes, who is NG, who happened to be a classmate to me. He is the person who is in charge of this project. He has worked very hard for the past years to make sure that this epidemic disease is eliminated from the Cameroon community.
Yes, so talking about the disease, can it be treatable?
Yes, leprosy is treatable. Leprosy is treatable. Firstly, the World Health introduced so many years behind what we call the multi-drug therapy, where a series of antibiotics were administered to patients suffering from leprosy. And these antibiotics take care of any form of those leprosy. So we call it multi-drug therapy. But it took a very long time to be treated, about 24 months. So research again came out with what we call fixed duration treatment, where they have to identify the particular leprosy, the particular type of this Hansen disease, and then give particular treatment. And this one is taking a shorter time. So within 6-12 months, those suffering from leprosy can recover.
Now it's time for our listeners and viewers to participate in the program, and I guess our technician will soon be displaying the following numbers where you can all call. And before calling, I think there's some rules you have to give, Lucy.
Yeah, of course. Before calling, you have to ensure that your radio set or TV set is switched off so that we don't have any complication while communicating.
The numbers have been displayed.
And the numbers, you can join us through the numbers 670-547049 or 656-622222. I read again, 670-547049 or 656-622222, 2222 at the end.
Back to you, Dr. Ofo. Is there any specialized center in Cameroon where leprosy patients are being taken care of, and how much does it cost?
For now, backward as 1965, the Mbingo Hospital has been a very special case where most of these patients were handled. For now, I don't really have a sound knowledge whether they are still continuing with the process of treatment, but I think just from most information, there happens to be a center too in Fumban, which is catering for this, those suffering from this infection. And we are encouraging people to take their patients there. And we want that in some society, people consider people with the lepra as kind of divine curse. It's not a divine curse. Some are called witches and wizards. No, this is just a natural disease that can come. And though we know it happens mostly in low-income society, a society where people are struggling, they don't live well. There are possibility of having it. So I think for now, people can visit Fumban. I got an information there's a treatment center there. We can do more inquiries. And still do more inquiries in reference hospitals in Cameroon. We'll still have more centers that they could be handling these cases. Though the cases, 300 cases as compared to almost 30 million people, we are thanking God that it's a bit negligible.
Now, let's talk about hospitals handling these cases. Does it mean any doctor cannot handle a leper or treat a leper? Are there specialists meant for these cases?
Mostly epidemiologists, people who are specialized in skin infection can handle leprosy. And then even nurses can be trained on how to go about treating these patients. There will be no problem. Anybody can handle this. But to an extent, when the situation is maybe has gone through threshold, it may need some specialists to also cater for these patients. But generally, they are easy to handle when instructed on what to do.
Given that it's highly contagious, don't you think that these doctors and nurses taking care of such cases, how then do they protect themselves from being infected with a disease?
I think treating most patients lepra, we have to go on serious hygiene. We make sure after treatment our hands are sanitized. We use hand sanitizers. We use gloves while treating them. And then we also need to also not to make them have a trauma that maybe they are kind of outcast. We need to treat them with care, but treat them with some protection by protecting our own body too. It is very easy putting on hand gloves or using hand sanitizer. There will be no problem.
And how long does it take to treat a leprosy patient? How long?
So as I said before, it depends on the situation and the level of infection. But in most cases, averagely, statistics from World Health Organization shows that with the fixed duration therapy treatment, it takes about 6 to 12 months. Unlike the multi-drug therapy before, which takes 24 months.
And is there any specific diet, like when you're a leper, you're supposed to maybe follow a specific diet, a way of eating, an eating habit?
Actually, there is nothing we can refuse the lepers from eating, but there are things we can encourage them to eat more. Because already when you are infected with this kind of disease, which has an impact on the immune system, you need to take nutrition highly with antioxidant nutrition like vitamin A. Vitamin A is also known as retinoic acid. You can find it in oranges. You can have it in pineapple. They are good because they are antioxidant and they boost the immune system. We have vitamin E, and then we have vitamin C, ascorbic acid. We have vitamin D. Those vitamin foods are very, very good for those suffering from leprosy because it boosts the immune system. And equally, an antioxidant too boosts a production of a chemical in the liver called glutathione, which also ensures new tissues are being formed in the body, as leprosy mostly concerns the deformation and destruction of skin tissues. So vitamins are the best food for those suffering from leprosy.
Yeah, doctor, I wish to know, are there some diseases related to leprosy?
Actually, there is no disease really related to leprosy, but there is another disease, another complication which is close to leprosy, which is tuberculosis, because they are all caused by the same species of bacteria. Tuberculosis is caused by Mycobacterium tuberculosis, and the leprosy is caused by Mycobacterium leprae.
We have a call on the line. Come back to you. Hello?
Hello, good morning to you people in the studio.
Good morning, sir. Your name?
I'm called Father John, calling from Old Town, Bamenda.
Okay.
I just want to find out from the doctor, what are the causes of leprosy? So we just hear about it. We don't know what is the causes of the leprosy. I would like him to enlighten us, the public.
Okay, sir.
I want just to say good day to you all and good morning to all good human beings.
Thank you. Thank you.
Thank you for thanking me.
Okay. I guess he wants to still get information about the major causes which you earlier talked about, but just for his sake, we'll come back to the major causes of leprosy again.
Okay.
He's asking for what are the major causes of leprosy.
We
already talked about it, but for his sake, maybe he didn't get it.
Okay, we say leprosy is a bacterial infection. Like tuberculosis, it is caused by a bacteria known as Mycobacterium tuberculosis. Maybe we should be talking about the avenue where we can get this bacteria. This bacteria grows more in humid climatic conditions. That's why leprosy is well widespread, but more common in sub-Saharan Africa, where the environment is humid, where the environment is conducive for them to multiply. It's only one bacteria that causes it. There may be different forms, but the cause is the same. Okay. It's still the same by Mycobacterium.
So now, how can we prevent ourselves from being victims of leprosy?
For the past years, there are effective drugs. I would like to refer people who are suffering from this first to go for, if you want to treatment, they'll be there. But protection or prevention of leprosy, it will need good hygiene, good sanitation, good food, good environment. We make sure our environments are clean. Anything related to bacterial infection or viral infection or protozoan infection, it always requires a good hygienic conditions to maybe stop the spread of this bacteria and also stop the multiplication of this bacteria. So one of the things too, we know that it is in Africa. It's only when we hear an outbreak before we start going to use hand sanitizers. We start concentrating on washing our hands before eating. This should be a daily practice, because unlike any other bacteria, although this one is an epidemic disease, which means if you hear it's outbreak, you start taking precaution. It doesn't mean that when you hear that it's in the far north, it doesn't mean it is not in Douala. It can be transmitted in the food brought from far north. It can be transmitted from the food brought from any of the infected area. So it's good hygiene. It's one of the major things to take care of. And then also when we are taking care of the patients, we should make sure that at the end of the day, our dresses, our materials we have used should be disinfected. If we're taking care of people suffering from leprosy, we disinfected the equipments. We also clean ourselves off, because we could always pick the bacteria. It could be lethal in some people and dormant in other people.
Are there any available vaccines at the moment?
For the past years, the World Health Organization has been fighting on a vaccine. I think all of us know, for the moment, there's no vaccine, but BCG, which is a vaccine which is given to newly born babies, or babies born some few months after, is against tuberculosis. They have tried this vaccine on the leprosy, and they discovered that it works to an extent. It has an impact to prevent leprosy, because since the causative agents are of the same species. Now they are working, there's serious research now to see how they can come up with a blend vaccine, because BCG still have some challenges. So they want to come up with a blend vaccine which can be used to prevent all the mycobacterium, which means prevent tuberculosis and at the same time prevent leprosy. That's the research which is on the ground, done by many health organizations with specification of World Health Organization.
Okay, doctor, thank you very much. But can we really completely scrape out this infection from our system, to say?
Yes, leprosy, like other neglected tropical infection, is not a health crisis. It's not something we should panic that we have heard that it is an outbreak, because there's a possibility. It's very easy to eradicate it. When you isolate those who are infected and you treat, if you identify the infected persons, you isolate them and give proper treatment, you close the chapter of that area. The problem now comes in identification. Who has it? Which parameters? Which method are we using to identify those infected? Some are infected, they may be dormant for some time. They are not manifesting, but they are infected. So if these are identified and treated, isolate, treat, I think this could eradicate leprosy completely.
Thank you so much, Dr. Ahmed, for participating on this edition of the program. Thank you so much, Lucy.
It's a pleasure.
And thank you so much, ladies and gentlemen, for your keen attention. That's where we put an end to today's edition of the program, You're in Your Health, aired on Equinoxe Radio Multimedia. For presentation, I am Immaculate Fogwe and AC Lucy, and we received technical assistance from Raphael Dipanda and Bertrand Bonzini. Have a lovely day in the company of more interesting programs on Equinoxe Radio and, of course, television.